This video presentation provides information about the evaluation tool of children's handwriting, also known as ETCH. The ETCH is a standardized criterion-based performance measure that assesses legibility and speed of handwriting. It also informally assesses skills in using a writing tool. There are two versions of this assessment that can be used. The ETCH-M evaluates manuscript handwriting, or printing, and the ETCH-C is used for cursive writing. It takes 15 to 30 minutes to administer the ETCH, and the initial cost for the materials is $200. The ETCH is standardized for children ages 6 through 12, or those in grades 1 through 6. It can be used for any child experiencing handwriting difficulties who also has a diagnosis of a learning disability, mild developmental delay, or mild neuromuscular impairment. The ETCH may not be appropriate for more severe intellectual or neuromuscular impairment, as handwriting must be a feasible occupational expectation for the child. The ETCH requires children to complete 6 or 7 paper and pencil tasks, depending on which version is being administered. These tasks include unaided formation of upper and lowercase letters and numbers, so writing the alphabet and numbers 1 through 12 from memory, copying a sentence from a nearby model and one from a model further away, letter-by-letter dictation of words and number-by-number dictation of a zip code, and independently composing a sentence of at least 5 words. The cursive version has one additional task in which the child translates words and letters written in manuscript into cursive. Throughout this process, administrators are also observing the child's pencil grasp, hand preference, pencil pressure, and pencil manipulation skills. Here is an example of a near-point copying task. The child was shown a nearby model of the sentence, "Ships flew by the moon," and asked to copy it in the space provided. Scoring is standardized for measuring speed and legibility in handwriting skills. A speed score is determined by the number of tasks completed in a specific time frame versus the total number of tasks required. Legibility is scored based on the number of individual errors made versus the total number of individual letters, numbers, and words required. The ETCH provides scoring codes to use as a guideline for evaluating handwriting errors. These include incorrect letter case, formation, or size, the letter or word is omitted, illegible at first glance, improperly aligned with the horizontal line, or improperly spaced, or the skill is unacquired or the child refused to write. Here is the same example of a near-point copying task showing the administrator's scoring of errors with rationale included for each. The administrator notes that the child's sentence is illegible overall, primarily due to poor spacing between letters and words, and that 5 out of 18 letters are classified as illegible. In terms of normative information, the ETCH does not provide comparison data or official guidelines for interpreting scores. However, research studies have been conducted to establish minimal clinically important differences and cutoff scores for reference. Results from a study conducted among 2nd and 3rd graders with ADHD indicate that clinicians should consider an increase of 6% or greater in scores for total letter legibility as clinically significant and 10% or greater for total word legibility. 2 other studies conducted among the same age group both found that a score of less than 76% for total letter legibility and less than 75% for total word legibility can be used to determine that a child with handwriting difficulties should receive rehabilitation. Test-retest reliability was shown to be adequate to excellent for most ETCH tasks, but was poor for near-point copying and sentence composition. Inter-rater reliability is adequate to excellent across all tasks. Predictive or concurrent validity has been shown to be adequate to excellent, and discriminant validity is adequate. There are a few potential biases that may be associated with using the ETCH. First, although validity and reliability of the ETCH appear to be at least adequate, scoring is very subjective and up to the administrator's judgment. Similarly, a child may have learned to form letters in a way that qualifies as illegible to the administrator. Another bias is that the ETCH manual and task worksheets are only available in English, which excludes its use among children who speak and write in any other language. Additionally, the time limit placed on the child to complete the tasks may cause increased anxiety and unknowingly skew results for speed. Finally, the ETCH-C is less relevant and useful these days than the ETCH-M, as many children are not even taught cursive handwriting as part of their school curriculum.